Last week, I saw more than 10 women in the office who came in for treatments, laser hair removal treatments on their faces, and they had diagnoses of PCOS. Now, I primarily focus my practice on women of color, so it makes sense that I'm going to see a lot of women of color who have issues that are very common in our community. But I just didn't realize how common PCOS was and how little information people had on these conditions. So I decided I'm going to start talking a little bit about PCOS, just giving out general information that is necessary for a diagnosis, and something that you can kind of use in conjunction with going to see your physician to get diagnosed if you're suffering from any of the things that I'm going to talk about. So PCOS stands for Polycystic Ovarian Syndrome, and the main features of PCOS is elevation in male hormones or androgens and loss or irregular periods. The key thing to pay attention to when it comes to this entire syndrome is the elevation of androgens, or male hormones, because they play a part in all the clinical symptoms, or most of the clinical symptoms that women are going to experience. So starting from the face, women with PCOS are going to develop facial hair, especially around the chin and the jawline and cheek area. But they can also develop hair in other places, such as the chest, areola, back, upper arms, happy trail area, the back of the thighs, and the inner thighs as well. That's all due to male hormones. Naturally, we have vellus hair or thin hair in those areas, but because you have the presence of male hormones in your body, that's going to induce those hairs to become more androgenic hair, and that's why you get that male pattern of hair growth on your body. Now, these male hormones are also going to cause other issues such as acne. So if you have adult acne that is not something that you had as a child, it is possible that is due to PCOS, because again, androgens can cause you to have acne because of sebum production. So many different things, but acne is also one of the things to look out for. Now, in your ovaries, you can develop polycystic ovaries, so multiple cysts in your ovaries, and these cysts can also be the reason why you're getting a high production of androgens. So women with PCOS usually have irregular periods or no periods at all, and this can start as early as when they're starting puberty. So they can have a delay in their puberty, or they can have regular periods and then eventually find that they're starting to have irregular periods, and then eventually it disappears. For some people, they only realize that they might have PCOS when they decide to start the process of trying to have children, because again, PCOS in a lot of patients can cause infertility. Other issues that are associated with PCOS include hair loss, so male pattern balding is very common in these women. Metabolic issues such as insulin resistance that is seen in patients who are either obese or actually who are of normal weight. And this predisposes you to potentially diabetes and other cardiovascular issues that can lead to heart attacks, strokes, etc., etc. It is also associated with fatty liver disease, sleep apnea, and mood disorders such as anxiety and depression. Because of this elevation in androgens, women who have PCOS, a lot of them tend to have an interesting body structure. So they tend to have a male pattern body structure where they have more broad shoulders, and sometimes they have deepening in their voice, and then they'll have like a smaller waist. So think of an upside down triangle where the shoulders are very broad and they have a lot of weight in that area, and then as you go lower, the waist is much smaller, and then they have normal legs. Personally, I think that tackling the obesity component of this is really important, because excess body fat is also going to predispose you to having androgens outside of the uterus, right? Because excess fat is going to get converted to cholesterol, which is a precursor to all of your hormones, and some of those hormones will get converted into testosterone. So it's really important to get the fat on your body, the excess fat out of your body. Now, there are two things that are a very good option, in my opinion, for these patients. Following a true ketogenic diet is a great option for patients who have PCOS. Also, doing intermittent fasting is a great option. It's a great option with a short window because, again, you're decreasing that insulin resistance. And I'll talk a little bit later on another video about intermittent fasting because I need to do one on that. When it comes to exercise, cardio is your friend. So do cardio, walking, running, but stick to cardio. It's really important to do that. Next part will be on treatment options. So now let's talk about the treatment options for PCOS. In my last video, I actually started talking about weight loss because that's a huge component for these patients. So making sure that you're sticking to a diet that is whole foods, minimal carbohydrates, basically a low carb diet or ketogenic diet is a good option for these patients, or incorporating intermittent fasting is also a great option for these patients. Also, your doctor might prescribe medications that are going to help tackle the insulin resistance portion of it. Also, you can be put on birth control pills because that's going to help regulate your hormones. Or you could be put on hormone blocking medications as well. So it really depends on what you and your physician decide to do. But I think it's always important to start with lifestyle modifications, which is diet and exercise. And like I said, make sure the exercise that you're doing is cardio based and not weight based. And I might go into another video on why that is important. Now, losing weight is going to help not only with the insulin resistance portion, but with the elevation in the fatty liver, for example. So elevation in your liver enzymes, elevation in your cholesterol numbers, and weight loss as well is going to help with sleep apnea because obstructive sleep apnea also has an association with obesity. So losing weight really helps with so many different things in this situation. Now, for the excess body hair, that's where I usually come in. Laser hair removal, in my opinion, is the best option. My patients get better results when they're on treatment for their PCOS. But if you just have Hirsutism that's not associated with PCOS, then you're going to get good results with laser hair removal as well. Ultimately, it's important to understand that PCOS is more of a chronic type of disease that needs to be managed. It's not something that can completely be cured. But I really wanted to talk about this because so many people just blame themselves, especially when women find that they're having a really hard time losing weight. They just blame themselves. A lot of women actually end up with eating disorders because they think, it's their fault. It must be something that they're eating. But a lot of times, elevation in their androgen levels is what's causing them to hold on to all this upper body weight, and they have such a hard time getting rid of it. So if you struggle with this, it's not your fault. It's a medical condition that can be treated or managed. If you're a parent who has a kid that looks like they have some of the symptoms that I'm mentioning, then please take them to the doctor. But yeah, PCOS is so common in our African American community and Hispanic community. And I just thought I would give you guys some information that could be helpful in case you don't have any information. I'll see you on the next video.